Hi there, I'm Jay. I'm an orthopedic nurse and I'm going to be demonstrating how to use the PAPR. The PAPR is a powered air purifying respirator. It's going to replace the N95. For those of us who have a beard, or for those who the N95 doesn't fit properly and there's risk of contamination. This is the basic model. It's a waistband that will fit around the small of your back. Okay? The unit is attached and can be detached, but I think for simplicity, you should keep it attached in the unit and you can just take this out of the box. Other items, we have the battery charger and then the battery. The battery just lines up. If you pop it right in like that, it takes 3 hours for it to charge, and it should last between 10 and 12 hours. To take the battery out, we just press the blue button and lift up. The battery is going to be placed on the bottom of the PAPR unit. Little connection there and the connection on the battery, they line up. And again, you come in at an angle, click it into place. To remove it, again, press that blue button and it'll pop right out. What we also need is a HEPA filter. Now these HEPA filters are a little better than the N95 in that they'll filter 99.97 of the air, where the N95 will filter at 95%. It comes with a little plastic guard that you can remove when you take it out of the box. And again, this will be placed, there's instructions on the PAPR, a little picture on how to place the filter in. We can just slide that filter there, click that in place, and then there's a cover that will also go on top. Again, to remove, we've got two blue buttons, and we'll just depress those blue buttons and the filter will pop right out. The other items that we'll need are a hose and then a hood, and we'll talk more about these in a little bit. When we first get the unit going, we get the battery on, we place the filter in, we have to test the filter to make sure it's giving us enough power. And there's a device here, a little egg float we'll call it, okay, and when we place it, attach it right on where the hose attachment goes, and then we turn on our unit. It should elevate that ball, and we want the ball to be between, it's hard to read on here, but we want it to be between J and K. Okay, if it's a little higher than that, it's okay, but we don't want it lower. If it is below J, then we need to change our filter. And this here, the reason they decided to go between J and K, it's based on our elevation and our temperature. So it's kind of a range, and we're at 5280, and usually our temperature range is between 70 and 80 degrees in the hospital, so that lines us up between J and K. Now this unit is good to go, the filter. I'm going to turn this off. And let me show you that while we're at it. We have a power button, is right here, another blue button, and we'll just hold and depress that till we hear a beep. And then there's a fan. And there should be, so we're warming up right now. There are two speeds for the fan. So there's low, and then there's high. At the point you start hearing the alarm going off, meaning your filter is clogged, you need to get out of the room right away. Don't try to troubleshoot the unit inside the room. If you do, it'll go into a sleep mode and it won't work. You need to come out of the room, you need to turn the unit off, and then you need to replace the filter. This unit has the hose, And this hose will attach right where we had the egg float. And it's just place it in and then give it a little twist. And we also have the hoods. Now the hoods come in two different sizes. We have a small, medium, and then we have a medium large. It says S133L, and the L is for large. Whereas the small hood, S133S, S for small. The hood goes on the other end, and again, it's just a push and it's snap-on together. This pack is designed to be worn on your back, so it should be placed right at the small of your back. What I recommend doing if you're by yourself is to place the hood and the hose over your shoulder, and then you can fish around, grab the belt, and secure it to your waist. And it's just like a backpacking belt. If you need to snug it down, you can. And then we'll take our hood. We're going to turn our unit on, and you can reach back, hit the power button, and then turn on your fan. The hood also has a protective shield that you should rip off so you can see clearly. And inside the hood there is a forehead band, and that should ideally be placed right on the middle of your forehead, right here. And then this strap here, which is adjustable, will go around the back of the crown of your head. What you do, it's got a little pull tab, okay, and you can hold on to the base where the hose is, and just slide it right up over your head. Now the face shield should be right in front of the ear. And then if you have any extra hair or long hair, you should wrap that up and place that up underneath so all your hair is covered up. And there we have. And now this is a positive pressure, so it's constantly blowing air into the hood, and you're breathing in. And then you expire, comes out of the hood. Again, I want to stress, don't take this off until you're outside of the patient's room, okay? Just for your own protection. When you do get outside, these hoods are designed to be single person use, but they can be used multiple times. With that being said, we just clean it like we would any other piece of equipment. And depending if we're using our purple or we're using our orange top for a C-diff, we just go ahead and wipe it down. And I would suggest maybe just writing your name on it if multiple people are using the PAPR unit, so they're not using your hood. They'll get their own hood for that. We can also, once it's cleaned, at the end of your shift, clean the inside as well. And then let it dry, and then you can stick it into a bag, a Ziploc baggie. You can store it in your locker until the next time there's a need for you to use it. So when we wipe this down, we can wipe down this whole unit, and we would just use the purple top or we use the orange sandy wipes. Just wipe it down and do as you would any other piece of equipment. At the end of its complete use, when the patient has been discharged, if we need to, we can disconnect the hose. We can submerge the hose down in the water in a 10-to-1 bleach to water ratio to clean this. Again, the outside, we just clean the outside of it. We don't need to do anything inside. Take the battery off. We'll replace the battery in the charger. The filter, as long as the filter is, our egg drop is giving us a good read between J and K, then we don't need to change our filter out. We'll just put it in the box for the next time.